Hi, my name is Stephanie Castillo, and this is my presentation in my clinical study. Patient is a 55-year-old male who came into the clinic complaining of severe pain. He states, I have severe pain on my right toe. Pain onset is started 2 days ago. It is considered acute. It is severe, rated 8 out of 10 in the pain scale. Symptoms include swelling, redness, warmth in the toe. Possible triggers could be alcohol and purine-rich foods. Patient is impacted by pain as he cannot perform his daily activities. Patient CT is a 55-year-old male of Caucasian race with non-Hispanic ethnicity. Occupation is sedentary office job. History of present illness. Onset. The patient's pain began suddenly 2 days ago. Location is the right big toe. Duration is continuous pain persistent throughout the day. Character of the pain is throbbing, sharp, severe pain. Aggravative factors, walking, alcohol, and purine foods. Relieving factors for the patient, rest, elevation, and cold compress. The pain is constant, no periods of relief, and the severity is rated at an 8 of 10. The patient says he has never had a fever, though he sometimes feels tired. This might be due to the inflammatory process of his gout attack. He agrees he has severe pain, swelling, and stiffness on the right toe, which are characteristic features of gouty arthritis. The patient does not report having chest pain, palpitations, or edema that would point out to other systemic diseases such as heart failure or infection. He also reports negative symptoms regarding nausea, vomiting, and any abdominal pain, ruling out any gastrointestinal complaints. The patient has a history of mild intermittent renal colic, which might be important as gout is related to urate nephropathy. He has no difficulty breathing and is negative for cough, which mitigates against respiratory involvement. CT reports no known drug allergies, although he has had a rash reaction to shellfish, and this needs to be taken into consideration. Furthermore, he has a problem with pollen, which causes allergic reactions in certain months of the year. The patient stated no known allergy to latex products, no adverse reactions to herbs have been observed. This information aids in preventing allergic reactions that might be experienced during treatment, particularly when the doctor is prescribing a new medication. The patient's vitals are as follows. Blood pressure is 140/85. This means that the person has borderline high blood pressure or stage 1 hypertension. He has a normal pulse at 76 with a normal rhythm, therefore his physical examinations or results are normal. The respiratory rate is 16 breaths per minute, which is normal. Temperature is 98.6. His weight is 210 pounds and his BMI is high, which is regarded as a factor leading to gout. The patient quantifies his pain at 8 out of 10, which testifies to the intensity of the acute process. The patient's serum uric acid level is high, so the diagnosis of hypouricemia is a major factor in gout. A complete blood count is normal, meaning there is no indication of infection or blood-related complication. Kidney function is normal and serum creatinine values are within normal limits. Nonetheless, CRP is high, which indicates active inflammation. No hepatotoxicity is identified with liver functions. In aggregate, the laboratory data affirms the diagnosis of acute gouty arthritis. CT is presently using ibuprofen 800 mg 3 times a day for analgesic purposes. He is also prescribed allopurinol 100 mg daily to help with the condition of uric acid to minimize gout attack episodes in the future. Both drugs are in the form of tablets to be taken by mouth with water at the recommended dose. The patient is using ibuprofen for occasional use as needed and allopurinol, which is prescribed for chronic control of uric acid. Labs proved that gout diagnosis and the patient was explained the importance of constant medication adherence. As discussed, screenings that might be used are the ESR test which measures the amount of inflammation in your body by indirectly measuring the level of certain proteins in your blood. CRP checks for inflammation in the body. Inflammation can be caused by infection, injury, or chronic diseases. CBC, which is a complete blood count, analyzes the cells that circulate in your blood. It's the most common test ordered by physician and can provide valuable information on the overall health and help detect problems like anemia, inflammation, and infection. Electromyography and nerve connection studies. EMG is used to evaluate the nerve and muscle function to diagnose carpal tunnel, neuropathy, and reticulopathy. Finally, a psychological assessment can be done to help identify mental issues that can be contributing to the chronic pain. In regards to CT's history, his medical history includes mild intermittent renal colic, which is not active at the moment. His surgical history just included ESWL, which is lithotripsy to help pass his stone. Family history, his mother has a history of type 1 diabetes, takes insulin. Father has no past medical history. Sister has a history of breast cancer, currently on remission. Grandfather history of lung cancer, currently on remission as well. CT admits to drinking alcohol socially. He used to smoke, quit 5 years ago with no relapse. No drug use or any substance abuse. He is married, lives with his spouse. He is employed in an office-based job, given it a sedentary lifestyle. Previously worked as a cashier. Sexual orientation is heterosexual. Sexual activity, he is active with no contraceptive use. Living situation, CT lives at home with his spouse. Stable and adequate family support. During physical assessment, CT's right toe is inflamed, red, warm to touch. A tenderness and extreme pain on pressure. Limited range of motion, stiffness is observed. No lesions, discoloration is present on the toe. He does have reduced mobility. No other abnormalities noted. Primary diagnosis for CT would be gouty arthritis based on the symptoms. Differential 1 would be septic arthritis, rule out with labs. Differential 2 would be osteoarthritis, less likely presentation. Differential 3 would be pseudogout, needs crystal analysis. Diagnosis confirmation, clinical presentation, uric acid elevated. Conclusion, gouty arthritis, primary diagnosis confirmed. Diagnostic testing includes serum uric acid, which confirms hyperuricemia diagnosis. Must monitor the kidney function to assess for neuropathic risk. Joint aspiration analyzes crystals to confirm gout. Ultrasound assesses the joints for structural damage. X-ray rules out osteoarthritis and joint issues. Additional tests based on routine labs. Pharmacological treatment plan. NSAIDs like ibuprofen control pain and inflammation. Coquelin provides rapid relief for acute gout attacks. Allopurinol manages uric acid levels long term. Administer orally as per dosing recommendation. Duration based on prescription and efficiency monitoring. Educate on side effects and adherence to medication. Conservative management strategies are critical for the management of gout. The patient will be encouraged to reduce the quantity of foods containing high levels of purines, since these cause high uric acid levels. More water should be consumed to maintain the kidney function and prevent the formation of urate crystals in the joints. The patient should also help themselves to avoid foods that contain alcohol because it's known to be a gout trigger. Walking and swimming should be encouraged as they have the least impact on the body and joints, but are very effective in exercising the muscle. Information for proper trigger assessment will be given, and compliance with the lifestyle modification will be assessed and managed accordingly. CT will be informed about foods that should be avoided, particularly alcohol and foods containing purines in their list. CT will periodically be reminded about the importance of kidney health and the necessity of sufficient water. Periodic checks of serum uric acid will be crucial to evaluate the efficiency of the therapy and avoid subsequent flare ups of the disease. Regular follow ups will be made every 6 months, and the patient will be asked to come after 2 weeks to see the current management results. It aims to decrease the recurrence and intensity of gout episodes in the long run. Assessing symptoms and early signs of gout is a very important part of a nurse practitioner's job. NPs are expected to order the appropriate labs, including serum uric acid and joint fluid, to confirm diagnosis. The role of the nurse practitioner is to consult with other specialists if necessary, coordinate the treatment plan, and modify it based on the patient's response. The prominent focus will be paid to adherence to diet and medication. The American College of Rheumatology guidelines will be used to offer evidence based care.